we are going to go through a quick little craniosacral reset that you can do on yourself. One of the first parts of craniosacral therapy is to scrub the suture. The sutures are the areas in the skull where the bones come together. They fit together like puzzle pieces. Here I have a nice little model of the skull that shows different colors for each of the bones to help you identify them, or to help me identify them. Either way, we are not going to go through all the details of what bone is what. We're just going to be talking about these lines right here. That is what we're going to be working on scrubbing. So we're actually going to start in the front because this one's a little bit easier to feel and a little farther back than we really think it is. Okay? So this bone right here, this is our forehead, and we're actually going to come back until we feel a little divot, and then you're just going to do a nice little rubbing, scrubbing, kind of like you're washing your hair through that area right there. What you're going to do is you're going to take your fingers and you're going to get to your hairline or the top of your forehead and just go back until you feel a little divot. It's going to be a little farther back than you think. So it's not up here. It's going to be about a little bit closer than midway. And then just rub through there. If you don't want to scrub, you can just kind of press and rub. And just follow that around. You can even just bring your fingers back and work on feeling where that area is. This is pretty subtle as far as the feeling where the divot is, so it's okay if you don't feel like you can find it. All right, we're gonna move on to the temples because that is an area that we really do feel. There is a bone right here in our temples that actually comes into behind our eyes and through our sinuses. So if you just find your temples, which is the nice soft spot on either side of your eyes, and just trace along the edge of the soft spot. That's all we're doing right now, is just finding the soft spot and going from that middle out until you find the harder bone. And just trace along that. Ooh. That spot on the inside, closer to the eye, was fairly sensitive for me. You might find some spots that are a little more sensitive than others. There we go. Now we're going to get to this bone right here. This one, our ear sits about here. This one is just along the outside of our ear. So you're just going to get back in there. This one's fairly easy to feel. There is a muscle over it too. So just kind of find your way around like a big pair of headphones. And again, you can either scratch, rub, or just kind of get in there and rub back and forth, moving the skin. Moving the skin is just as effective as rubbing over the skin. You might like one more than the other. I actually prefer to move the skin most of the time, but it just depends on what resonates with you. Everybody's different, right? Then we're gonna go to the other side and do the same thing. These ones feel really good when you have some ear pressure, or if you have some headache. A headache. These are really good spots to hit. You can even pull on your ears to kind of open that up a little bit more. I'm not going to pull on my ears too much because my AirPods will go flying out, but that'll help with that area. Next we have the back of our skull, so front, back. This is where your neck comes in. This is that nice area everybody likes to get massaged. Feels good down in here. We are actually going to come up around this suture right here and scrub along there. You're going to come back to the base of your skull where you start to feel it come in. It's actually going to be about here, so you're going to be on that bone on the side still. And come up. You should feel a little indentation about here. Just start following that a little bit around. and then come up at a diagonal. So if you see here, we're kind of coming up at a diagonal. Up, up, and end about the middle of your skull. So if you're laying down, it's about the point where you would, if you're laying down, it's about the point where your head would touch the bed or the floor or the table. Make contact. And then come around to the other side. Oh, this one feels really good today. If there are any spots that are super tender, you can just kind of hang out on there. If they're really, really, really tender, lighten up on your pressure. Just kind of hang out there with some much lighter pressure so that it's not really sore. Or go on either side of it. All right, last one that we're gonna do is this one right here. So we're gonna go from that. The last one we're going to work on is this suture right here, which runs down the middle of our skull. And so we're gonna go from that one in the back and then just work down the middle. And you're actually gonna come around the corner, around the bend, to about where your head hits the pillow again. Ooh. I'm gonna do that again because that one is pretty sensitive on me. Now you can choose to do any of these. Obviously there are more through the skull, through the face too. So on the cheekbones, you can get in there a little bit. You can actually hold the cheekbones themselves and there's actually a little divot right here where these bones attach, which is this bone right here. That bone. You can work those. Those always feel nice. You feel a little divot. Work those a little bit, and then you can get up through here is also nice, which would be here. There are some sinuses in here. So sinuses is in areas where the nerves come out of the skull to innervate the face. So be a little gentle on those. Give that a try. I'm sure you're gonna like some of them, and some of them are gonna be really uncomfortable. But that is just a quick little way to do a self-craniosacral treatment to help open up all of these bones and help them move a little freer.